Dr. Zanetor Agyemang-Rawlings is my guest. Doc, let's talk about why John Mahama and the NDC should be elected again and why you yourself should be elected. But even before then, to be elected, you need people with voter ID cards. What do you make of the registration exercise that was just done? The president has highly commended the EC and the boss. What do you make of it as a medical practitioner, COVID-19 EC registration?
I think it was a huge risk. It was a huge risk to put people through, given the fact that we were right in the middle of a pandemic where we didn't see a reduction in cases. At the time, when we started the registration exercises, we still were seeing an increase in the number of cases. And, I wouldn't want to belittle the fact that the number who died is not as high as perhaps one would have expected. And we've been fortunate. I think for whatever reason, we probably got off lucky, because given the state of the pandemic globally, it could have been a lot worse.
Is it that we got lucky or the government put in measures? Because the president, when he spoke to the nation on Sunday, said that, of course, there were so many naysayers, and those naysayers should be disappointed now because they really hope that something bad will happen. Was the NDC not too alarmist moving into this registration? Because at the end of the day, we do not have on the record officially any evidence that the registration has necessarily led to death or contraction of COVID.
I don't think that those who were concerned about it are disappointed. We're happy that we haven't had what we thought might happen actually pan out. Surely nobody wants to see Ghanaians dropping dead, However, the risk was there. And I did visit the registration centers on a regular basis, and I could see a lot of the lapses that were happening in the process in terms of protocols. And I actually made it my business to ensure that as much as possible the EC staff and people at the registration centers were adhering strictly to the protocols. We actually changed some of the ways we were doing things in my constituency with regards to people being asked to sanitize their hands before they place their fingers on the scanning machines, because that wasn't being done, because the machines apparently were, if they cleaned the machines after everyone used them, it was affecting the machines, so they couldn't do that, which meant that the machines weren't being cleaned. So we had to have a way around that. With regards to evidence, if you don't test, you don't know. Where all the EC staff tested after the process to find out whether any of them...
Do you think they should be tested?
I think that given the situation we're in, it would have been perhaps interesting, if nothing at all, for the sake of understanding what the situation was, to have tested them, because a lot of these staff who were placed, for example, in Klotekole, we registered a bit over 97,000 people. We had in the range of about 38 teams, from the EC. If we had 38 teams who had to deal with 97,000 people, that's a lot of people. And based on the law of numbers, one expects that their risk would be higher than just doing other things in the community. So it would have been interesting to actually test them to see what happened, because the only way to understand the behavior of a disease, to be able to come up with a disease model, is to actually test widely in certain situations, and that would have been a useful marker.
But having proven that they could do it, do you trust the Electoral Commission going into the elections?
You're asking me a difficult question. I think we need to ensure that going into the elections, we're all vigilant and we make sure that the Electoral Commission remains independent and does what it's meant to do to ensure that our elections are kept transparent and fair.